Floridians are lining up outside theme parks after businesses in the state were allowed to reopen last week following a 2-month lockdown. The reopening is coming at a high cost, with a record rise in the number of new cases of COVID-19. But Governor Ron DeSantis is ruling out more lockdowns.
We're not shutting down. We're going to go forward. We're going to continue to protect the most vulnerable. We're going to continue to advise, particularly our elderly population, to maintain social distancing, avoid crowds.
Arizona, Texas, Oregon, Nevada, and Oklahoma also saw their highest tally of new infections on Tuesday. Cases are rising in at least 9 other states as well. Officials say part of this increase is due to more testing. The US remains the world's worst affected country, with nearly 2.2 million cases and more than 118,000 deaths. Despite the rising pace of contagion, President Donald Trump's administration says the economy will not be shut down again.
I think we've learned that if you shut down the economy, you're going to create more damage. And not just economic damage, but there are other areas, and we've talked about this, medical problems and everything else that get put on hold.
Meanwhile, the Chinese government's adopted a different approach to combat a new outbreak in Beijing. It shut down markets and schools, grounded flights, and restricted travel out of the city. The worst affected neighborhoods are in lockdown while their residents are being tested.
On average, nucleic acid samples of 400,000 people are being collected citywide every day, and the capacity of testing will continuously be expanded in the next few days.
New Zealand's government is also scrambling to ensure it doesn't face a new outbreak after 2 infected people who had just arrived in the country were allowed to leave quarantine. Among other measures, it's tightening border controls and quarantine requirements.
The suspension of compassionate exemptions will continue until such time as we can guarantee a disciplined and rigorous system at the border that ministers have confidence in. I know this will be upsetting to some New Zealanders seeking to return home to visit dying relatives and loved ones. However, the risks to our collective efforts to eliminate COVID are simply too great. I cannot allow the gains we have all made to be squandered by processes not being upheld.
Health experts say rising cases in the US and fresh outbreaks elsewhere show caution is still needed to stem the spread of COVID-19. While resuming economic activity is crucial, they warn that ignoring social distancing and taking other precautions could cost many more lives. Mobin Nasir, TRT World.
For more on this, the Chief Executive of the Health Finance Institute, Dr. Andrea Feigl, joins us now from Washington, D.C. She was a former health economist at the Harvard Chan School of Public Health and at the Organization for Economic Cooperation and Development. Welcome back to the program, Doctor. Now, figures from the US COVID tracking project show almost 23,500 people have tested positive for coronavirus in the US since Monday. Texas, Florida, and Arizona are the worst affected. Do you believe we're seeing the start of the second wave of infections?
Thank you so much for having me on your program again. And yes, unfortunately, I think it's true to say that we're not just seeing the second wave of infections, we've barely completed the first one. So yes, indeed, we're still in big trouble when it comes to the COVID crisis here in the US.
Now, the top infectious disease expert, Dr. Anthony Fauci, has warned leaders of those worst hit states to really act aggressively to stem the rise in these new infections before it turns into a real surge, as he describes it. But the governor of Florida, for example, has ruled out another lockdown, fearing the effect it would have on the state's economy. Is there another way around this?
Sure. So generally, short-term pain in terms of a lockdown is really worth a lot of long-term gain, and that holds true even in this case here as well. In the absence of a lockdown, I think that masks have proven and have been shown that if 80% of the population was to wear masks, the infection rates could be significantly reduced. And there's obviously the testing, tracing, and isolation measures that are extremely important, as well as social distancing in the absence of a full lockdown that can still help in this case. And that needs to be communicated very effectively. And leaders have to lead in this case by wearing masks and urging the populations to keep up the good work to fight this virus.
Meanwhile, authorities in China have actually acted more aggressively to stem an outbreak there. They've cancelled around 1,200 flights, shut down schools in the capital, Beijing. Do you believe that authorities really should be watching what's happening in China right now to, I guess, learn from what they're doing now that we're seeing signs of another wave in Beijing?
Given the high infection rate of this virus, the stronger the shutdown measures when new cases occur, the faster you can actually start containing new surges of that virus. So what China is doing, again, is following very stringent measures, almost draconian measures, so as to open up faster again. And other countries that have followed stronger shutdown measures have then rebounded much faster, as we see, for example, in much of Europe, or take New Zealand for an example.